Hi everyone. Today we're going to be talking about gastroschisis. What is it? How is it diagnosed? Um, how is it treated? And what are the complications to look for? Gastroschisis is one of the abdominal wall defects. It usually happens where you have a baby that is born with the intestines on the outside. A lot of the times, this is diagnosed prenatally, but it can also be diagnosed postnatally when you see that the intestines are on the outside, there's no covering or sac on the outside of it, and it's usually off to the right side. It's usually diagnosed either by physical examination at the time of birth or prenatally with a prenatal ultrasound. At this point, we should probably quickly address some quick questions that people might have, especially when it's diagnosed prenatally. So, number one, patients with gastroschisis, do they have to be delivered early? No. A child with gastroschisis can be delivered at the normal time of delivery, so full term, unless there's an obstetric indication for earlier delivery. There's really no benefit to trying to deliver a baby with gastroschisis earlier than full term. The second question usually that people have is that can a baby with gastroschisis be born via cesarean section or vaginal birth? And the answer is there's really no reason to have a baby with gastroschisis only by cesarean section. If there is an obstetrics indication for having the baby with gastroschisis using cesarean birth, then by all means go for it. But just the presence of gastroschisis does not mean that the baby have to be delivered with cesarean section. And I guess the third question is, does the patient have to be delivered at a large tertiary center? And the answer is no. The baby can be delivered at any place where there is a suitable neonatal ICU, as well as pediatric surgical expertise. This tends to be in larger centers, but there are smaller centers as well that do have the capability to take care of a patient with gastroschisis. So talk to your specialist maternal-fetal medicine about the appropriate place to deliver your child. Okay, so now the baby with gastroschisis is born, it's been diagnosed. So usually the first things that happen is that they put in a nasogastric tube to decompress the baby's belly and intestines. They put in an IV to make sure that they have fluids running in the baby, and they also make sure that the baby is put into something called a bowel bag, and it's basically a nylon type bag that covers the entire lower extremity as well as the intestines to prevent heat loss, because the biggest issue is heat loss and fluid loss in these babies. And so they use this to help to minimize that. And then once the pediatric surgeon comes in, the decision is made as to whether or not to take the patient to the operating room, depending on the size of the defect and the condition of the bowel. After evaluation by a pediatric surgeon, the decision is made as to whether or not they need to go directly to the operating room, depending on the size of the defect, or if they will be able to fix the gastroschisis bedside. When I say fix, I'm talking primarily about putting the bowels back on the inside. The goals of this is, again, heat loss, fluid loss prevention, but also to safely get the bowels back on the inside without constricting the blood flow to the bowel. So that might involve one, either being able to put everything back at the same time, or two, putting it in a silo bag, which is a spring-loaded bag that goes in into the abdominal cavity, and then they gradually would allow the bowel or the intestinal contents to kind of be milked back gently into the abdominal cavity, and this can take up to a week. And sometimes, again, this involves going to the operating room to achieve that, or sometimes all of this can be done bedside. And some of that is surgeon preference, some of that is patient condition. At this point, we haven't really talked about any associated conditions, because in gastroschisis itself, you don't really have a lot of associated conditions, but you can have something called an atresia, which is where you have some blockage in the bowel. So it's not in complete continuity with each other. And if that's the case, then you will need surgery to fix it. A lot of the time, at a time when the bowel is put back into the belly, this is not known, and this is expected that we would not know at this point. And so if the baby does not open up meaning does not start to tolerate feeds and have regular bowel function by the time the baby is about 4 to 6 weeks old, then there is a question as to whether or not this is an issue with atresia. I say 4 to 6 weeks because a lot of babies with gastroschisis will have some intestinal motility issues, and it can take a while to start to have good bowel function. So not having bowel function early is not necessarily a sign that there's blockage. And so most pediatric surgeons will watch and keep the patient without anything to eat, feed them just with what's called TPN, which is IV nutrition, and then continue to decompress their intestines using a nasogastric tube or orogastric tube. So that's the treatment for gastroschisis. Special scenarios is when patients have something called a vanishing gastroschisis, which is when the defects is getting smaller while the baby is still in the womb, and that can actually constrict blood supply to the intestines on the outside. These are things that your specialist maternal-fetal medicine will be looking at before the baby is born to make sure that that's not happening, and if it is, then there will be a discussion had with pediatric surgeons about the next steps. But this condition, vanishing gastroschisis, can lead to something known as short gut syndrome, where the bowel on the outside can actually be lost and you end up with much less bowel, much less intestines that might require longer term IV nutrition. These are special conditions that really deserve their own video to talk about. Okay, so once a baby with simple gastroschisis is being taken care of, then and all the bowel is back on the inside, you wait until you start having some bowel function, you start to feed the baby, and from a complication standpoint, apart from the possibility of an atresia and the possibility of having short gut, most patients with gastroschisis will have some motility issues, but they tend to do quite well in the long term. The survival from gastroschisis is very good, and in the United States, it's over 95% for simple gastroschisis. And so these babies tend to do quite well. These babies are not normally rotated. Their intestines are not normally rotated, so you do think about the possibility of the bowel twisting on itself. But again, this is one of those things that is possibly rare, and it's something that your surgeons will talk to you about in terms of what to look out for. So there you have it. That's what you need to know about gastroschisis, what it is, how to diagnose it, how we generally treat it, and the most common complications. Thanks for joining.